That pneumonia.
Pneumonias in Kazakhstan.
More than 32,000 of such cases were registered in the country.
Over the past day, about 1,247 of COVID-19 pneumonia have been identified in our country. It is COVID-19 pneumonia with an accuracy of about 99.9999.
415 people died from pneumonia in the country.
This is our common tragedy to declare July 13th the day of national mourning for all deceased Kazakhstan citizens.
Today we will name the interim results of the tragic story, the name of which is COVID pneumonia. We invited medical experts, representatives of the healthcare system, as well as citizens of Kazakhstan, who have come face to face with the SARS-CoV-2 virus to our studio. Hello, I am Asiya Akbarova, and this is our new talk show about the most important things, Ulken. Everything that happens in our country affects everyone. Together, we will find answers to all our questions. Let's figure it out. COVID pneumonia is a new and completely unknown disease. Its nature, behavior, weaknesses, and strengths cannot be learned from biology textbooks. We're collecting this data as we speak. Unfortunately, the price for this new knowledge is the lives of our compatriots and hundreds of thousands of people around the world. However, without losses, we will not learn the lessons that we need to defend the world in this war. So let's look back and remember how COVID-19 pneumonia developed in Kazakhstan. July 2020 is repeatedly highlighted with red ink in the medical history of Kazakhstan. An unprecedented surge of pneumonia was recorded in the country. Even amid COVID-19 pandemic, the figures for the incidence of pneumonia turned out to be shocking. In the period from July 1st to July 8th, more than 39,000 of unspecified pneumonia with a course similar to the coronavirus were registered in the country. PCR tests taken from majority of such patients demonstrated a negative result. At the same time, the official total number of cases of COVID-19 for the period from the beginning of March to July 11 was almost 56,500 people. Pneumonia in Kazakhstan in terms of its indicators broke the records of the main anti-hero of 2020, SARS-CoV-2.
Of course, there are 2-3 times more of pneumonia cases than coronavirus infection cases, and there are fatalities too.
By mid-July, the statistics on pneumonia exceeded its last year's norms by 2-3 times. And this is summer, not a typical season for the disease. This has never happened. Doctors raised the alarm. This pneumonia is not similar to the classic bacterial one. For treatment, they began to use the COVID-19 protocol.
It is COVID-19 pneumonia with an accuracy of about 99.9999. Because we usually see pneumonia cases from October to March. In the summertime, common pneumonia is extremely rare.
The Central Asian Republic drew the attention, first from the closest neighbor China, then from the WHO, and then from the entire world. Michael Ryan, Executive Director of the WHO Health Emergencies Program, recommended Kazakh medical authorities to combine statistics on both diseases.
We're looking at the actual testing and the quality of the testing to make sure that there haven't been false negative tests for some of those other pneumonias that have provisionally tested negative, and that is likely to be a major cause of this. That in many ways, many of these pneumonia cases will also be COVID-19. They just have not been diagnosed correctly. But again, that remains to be seen.
In the second half of July, WHO received statistics on pneumonia from the Ministry of Health of Kazakhstan. From January 1st to August 2nd, according to their data, 256,500 cases of pneumonia of all types were registered in the country, of which 32,000 were in June, over 150,000 in July. While in the same period last year, slightly more, 77,000 cases. If last year 2,333 people died during the same period, then this year the number of deaths was 4,042. On August 1st, 2020, the Ministry of Health of Kazakhstan added the numbers on COVID-19 pneumonia to the official weekly statistics, next to the data on COVID-19. The WHO page on the topic pneumonia reports that in 2017, over 808,500 children under 5 years old died from pneumonia of various types. Wikipedia, based on articles from the U.S. National Library of Medicine, records 450 million cases of pneumonia per year, and annually about 1 million people die from this disease. For comparison, at the beginning of August 2020, the global losses from COVID-19 amounted to almost 760,000 people, with a total of 21 million cases. A simple math calculation allows pneumonia to be awarded the palm of absolute primacy in the current race for lives. So what is this beast, pneumonia? We will ask the pulmonologist Sumbike Salimova.
Sumbike Salimova, pulmonologist, associate professor, candidate of medical science, doctor of the highest category.
Hello. We are grateful for your visit to our studio. You specialize in lung diseases, including pneumonia. Could you explain to us, in a simple, accessible way, what happens to the lungs during pneumonia? During a common pneumonia that we have, the lung tissue is affected. And usually it is affected in one place. We say it's a focal pneumonia. Focal pneumonia are usually caused by streptococci. This is called typical pneumonia. Over the years, different types of pneumonia began to appear, which are generally called atypical pneumonia. And how does it differ typical from atypical? They're caused by other microorganisms, including viruses. And now the COVID infection that struck us all and caused a pandemic around the world, it is caused by this COVID-19 virus. It affects the entire pulmonary system, from the respiratory tract at first to the upper respiratory tract. Well, among some patients, due to various circumstances, we still do not fully know how this happens. The microorganisms get into the lower respiratory tract, and they affect the lung tissue. And, as a rule, it affects the tissue in multiple parts of the lungs. In this case, usually, the lower parts are most affected. And what's the most interesting thing is that not only the lung tissue itself is affected, as in the case of typical pneumonia, a typical one also affects the interstitial tissue. This tissue passes between the alveoli, that is the final pathways of the respiratory tract, and the vessels, capillaries, that cover each acinus, each cell of the lung. That is, this is a vascular lesion. Moreover, since there are vessels in all organs, in all systems, the brain and the cardiovascular system, and all other organs, gradually the disease starts to have negative impact on all organs and systems. Sumbike Salimovna, so this is a more vascular disease than a lung disease. Of course, at first it affects the lungs. That is not just the lungs themselves, not the acinus themselves, but the capillaries that are around them. And if the process is not stopped, then it will develop into the so-called polysegmental pneumonia. And we lose time. And a person is not under the doctor's care, in a specialized clinic, a hospital, then of course, damage to nearby organs continues. And first of all, the organ located nearby are affected. This is the heart, the vessels of the heart. And if these organs were previously affected, Then myocarditis, endocarditis, and so on develop, up to the heart attack. Does this mean that doctors have to treat several diagnoses at once, and pneumonia is not always the most acute one? Yes, of course. All associated diseases must be taken into account. Therefore, first of all, when a patient is admitted to a hospital, the first thing doctors do is learn more about his medical history. All previous illness that a patient had. Naturally, their condition worsens. It is crucial to pay attention to this and conduct therapy that will elevate the condition. This should be done as early as possible, especially among patients with the first-type diabetes, who have been ill for many years. They are especially susceptible. And the age doesn't really matter here. If previously we thought that young people do not get sick at all or get a mild form, now our view has changed. Therefore, this is a dangerous disease for the entire population. Children are already getting sick. They start getting pneumonia. Yes, the COVID one. Yes, they develop a Kawasaki syndrome. Yes, we talked about it. This is generally a very formidable condition. So a person might not know that he may already have COVID pneumonia. What are the first symptoms to look out for? What are the first signs people need to pay attention to and take either an X-ray or a CT scan? Can you talk more about it? Because many people say that CT scan irradiates, and the COVID pneumonia foci can be identified also on X-ray. The complexity of this disease lies in the fact that incubation period can be very long, from a week to 14 days. During this time, a person does not experience any symptoms. But the process is already happening, right? Yes, the process has already started. The only thing that you can do is be very careful. Therefore, be on the alert all the time. We are now, as they say, in a pandemic system. No one has canceled the quarantine. The quarantine should continue until this disease completely goes away. Therefore, we should always wear a mask. Also, you need to know who you are communicating with. You must always keep that in mind. Forewarned is forearmed. Well, you have to be in a state of fear all the time. No, don't be afraid. Forewarned is forearmed. Therefore, you should always keep in mind this disease. The first symptoms can be a minor choking, temperature, weakness, or fatigue. There are symptoms that are very common. Can it pass without temperature? At first stages, it can pass without any fever. For 2 or 3 days, there may be just a minor choking, discomfort in the throat. The airborne pathway of infection is necessarily a lesion of the upper respiratory tract. This means damage to the larynx, pharynx, and the back wall may be inflamed. So, wear masks all the time, so as not to affect others if suddenly you get sick, and so that others do not infect you. Can a low temperature be a sign of the infection? Below the norm, around 35.5. We hear that a lot now. During pneumonia, no, it doesn't happen. It doesn't happen. No. That means the temperature wasn't taken correctly. It happens with the electronic thermometers. Yes, electronic thermometers often give such an error. I read that a low temperature can be with COVID pneumonia if a person already has some kind of malignant neoplasms, or when the immune system is very weakened. They can be single unique cases, but they are very rare. As we say, their premorbid background has already been changed before. Therefore, initially they had it already low. Such people may have a low temperature, even when they begin to feel unwell. And they measure the temperature, and they seem to have it within the limits of the norm, around 36.6, 36.5. For them, it's considered already an increase of temperature. You need to be on the lookout and still take probably a scan. What is better to do, X-ray, fluorography, or a CT scan? Well, fluorography, let's not talk about it at all because it's prescribed method in cases when the primary patient came and in general, he is not sick and no one suspected a COVID infection in general. This is such a mandatory method that we use for everyone. We do it, we did it, and we will continue to do it for everyone who came. It's better to do fluorography. No, it should not be done when a COVID infection is suspected. Why? Because it's not very informative. It is not very informative. It is not very informative. Fluorography is not very informative. I support this threefold. X-ray. Radiography digital poly means polypositional. That is, it can give both direct and two lateral projections. To get rid of any panic, as they say, to clear all the air and to get a more concrete picture of the situation so that the doctor can already decide whether something is already there or not. Can he already suspect something or do something there? But when we already suspect a COVID pneumonia, when we see that a patient has or already develops its symptoms, it is desirable to do a CT scan because it gives a detailed picture in dynamics. This method can also be applied. But the fact is that, of course, the radiation load there, as we say, is of course higher. Therefore, it's necessary to prescribe it very carefully, especially if it's done more than once. Only when there are already special indications for this and the doctor has great suspicions. The patient himself should not prescribe anything for himself. Neither examination nor treatment. Everything should be done under the supervision of doctors. Our doctors are now well informed. There has been enough of pneumonia. Do you think the treatment is effective? I think it is, due to the fact that by this time a sufficient amount of observation and knowledge has already accumulated. All the forces of medical staff and workers are connected here, from the ministry's end to the polyclinics. This is a primary link. Everyone is very knowledgeable. Everyone is on the alert. Therefore, they use all the knowledge that our entire world medical community shares. Here we actually had no borders. We are all totally united. And therefore, there is at least some decline of the disease. It's significant due to the fact that there was a quarantine. What happened in July and what is now is a big difference. This is a huge work of doctors. Most importantly, doctors started to use medication that affects the blood vessels, the blood coagulation system. Antibiotics, which are usually used for pneumonia, should not be at the forefront, because they are used when a bacterial infection, a secondary infection, adjoins the same infection. Only then we should use antibiotics, because they can worsen the condition. Really? Yes, and even cause side effects to other organs. Sumbike Salimovna, here's another question. What is the correct name of this type of pneumonia? Covid-like pneumonia or pneumonia with signs of COVID-19? It is correct to call COVID-associated pneumonia, polysegmental COVID-associated pneumonia. All pneumonias are now considered COVID-associated pneumonias, given the epidemiological situation. Well, Sumbike Salimovna, it only remains to say we should bear the responsibility too, because we must take care of ourselves, keep our distance, do everything in our power to protect ourselves and our loved ones from this disease. Thanks to you and your colleagues. Health to you and your loved ones. Thank you. Goodbye. The links between so-called unspecified pneumonia and COVID-19 are discussed at the highest levels. The Ministry of Health of Kazakhstan divides statistics on both diseases into different columns. And the World Health Organization keeps a general record of patients with coronavirus and pneumonia. Official medicine does not put an end to this issue. We invited a girl named Yulia to our studio, who claims to have contracted the coronavirus directly from a patient with Covid-like pneumonia. Let's learn more about her story. Yulia, hello. You have successfully recovered from COVID-19. Congratulations. So you didn't have pneumonia. However, you caught the virus itself from a patient with COVID pneumonia. Right? Yes, that's right. Plus, your express test was false negative, which is a common case. Tell us how it all happened with you. I was visiting someone, and after a few days, I was told that they had a confirmed result for COVID-19. When did this happen? It was August 1st. So in August. Naturally, of course, I took the express test. It showed a negative result that I was not sick. Well, I calmed down. But then my body began to behave very differently. I was constantly tired. I didn't understand why I could not come to my usual state. And I began to realize that the express test was most likely false. And in 3 days, I took the PCR test. So the first thing you paid attention to was the fatigue, weakness. Yes. Were there any other symptoms that alerted you? Before PCR test, no. But on the day when I took the test, my temperature rose to 38. And when I was waiting in line, I felt very bad. So bad to the point that I couldn't do anything, neither get up nor take the test. I lay down on the bench and waited for my turn. How bad was it? When you feel neither hands nor feet. When the temperature presses to such an extent that you want to hide somewhere, and so that no one touches you. How long has it been since you were in contact with this family until your first symptoms? A week. So during the week, everything was normal, and after a week, you had a fever. Yes, abruptly, in one day, in the morning, I just got up and felt very bad. The family you were in contact with had a COVID pneumonia, which you found out later, right? Yes, they all started getting tested. There are 4 of them, and all 4 fell ill. 2 of them are over 60, and 2 who are 45 years old. Naturally, these people were in a very bad condition. They were diagnosed with pneumonia. And you had coronavirus, yes. Just proves the link between coronavirus and pneumonia. Yulia, how are those now with whom you have contacted, from whom you've become infected? If we take the COVID condition, then they recovered. But they got heart complications. That is, now they're already busy treating the heart. What about pneumonia? They cured pneumonia. They were treated for a long time, for 3 weeks. And their treatment was so tough. They hired doctors who came home. And they used a lot of droppers, antibiotics, drugs. They were on the edge of being hospitalized or stay at home. In principle, everything went away, not counting the consequences for the heart. They are no longer treated, they only deal with the heart now. Tell us how long you were ill. 16 days. 16 days. What drugs have you been treated with? Have you been treated at home or have you been hospitalized? No, I was at home. I drank antiviral and a lot of vitamins. In principle, I'm against antibiotics. I don't take them, and I somehow understood, probably from my body, that I was being treated correctly. It was not self-medication, of course. I consulted with a doctor. No echoes, side effects, as they say, no complications. No, not at the moment. There were also terrible headaches, and I felt very weak. But it's okay now. Apart from certain interesting functions in my body that I have now gained. For instance, the senses of smell and tastes are back, but they're different now. That is, now I feel... Have you seen the movie Perfume? I feel like that person. Wow, so the feeling became heightened. Yes, it's different. I feel everything from the inside. You have received some additional options. Yes, I'm even a little afraid of it, but I'm observing it now. Yulia, what do you think played a decisive role in your recovery? I believe that this is a complete peace that I have arranged for myself for this 2 weeks. Self-isolation and, of course, a lot of vitamins that invigorated the body. There was also breathing exercises, which I did from the first day, as soon as I learned about it. Because I understand what pneumonia is. I understood that I could acquire it in the same way as those people with whom I was in contact. What vitamins did you take? Vitamin C and vitamin D. You said that peace was crucial. Although it is sad that with COVID infection, there should be no rest, it is desirable in the country to be very active and move often. You see, the state that I was in when I had COVID-19 doesn't allow movement. As I mentioned before, I felt neither my legs nor arms for some time. And you forced yourself to do breathing exercises. Yes, every day. It was a must thing to do. Good. In general, what's like to go beyond a dangerous line and come back? It's very scary. Of course, I was not in intensive care, I didn't have pneumonia, but what I and my body have gone through is very painful. It hurts so much that, in fact, I've never experienced this. My pressure dropped to 80. I did not understand what was happening to me. What's your normal blood pressure? 120. The state I was in, the pain in my body I felt, it was unbearable. It felt as if someone had tortured the body so hard, as if it was crying. And I had the headaches every day. Absolutely every day. It didn't leave me for a second. It didn't allow either thinking or making any decisions. Have you taken paracetamol? I was taking very strong painkillers that could not manage this pain. It lasted for 6 days continuously. I had no sleep, nothing. I felt like a vegetable. How's your family? I was completely isolated. Neither the parents nor my child were near me for 16 days. Well, who helped you for 16 days? Myself. But you said you could not get up, you had headaches. Yes, but I was by myself. I managed it because the health of my loved ones is more important to me. We also have deliveries that brought food and medicines, and the nurses who did IVFs. Well, Yulia, I'm very happy for you that you're already doing well at the moment, that there are no complications for sure. You don't have any chronic diseases, and it's good. You feel great. You shared your experience. Thank you for your time. Health to you and your loved ones. Thank you very much. Yulia's story confirms the connection between coronavirus infection and pneumonia with similar symptoms. And in both cases, it's not enough to just recover. There is a long road ahead of rehabilitation. Rehabilitation physician Ayna Bakeyeva is in our studio today to tell you how to properly recover from an illness. Welcome, Ayna Almuratovna.
Ayna Bakeyeva, Chief Physician at Private Clinic, Shymkent, rehabilitologist, kinesiotherapist. During the COVID-19 pandemic, she conducted a free consultation for patients with CVI in Kazakhstan and abroad.
Thank you for taking the time for our program. Today, not only Kazakhstan is watching us, but the whole world. And your experience in the rehabilitation of patients with COVID-19 and COVID pneumonia is very important. Let's talk about the consequences of COVID-like pneumonia. How do they differ from classic bacterial pneumonia? When there is a classic pneumonia, most often bacterial pneumonia, then the most affected areas are the bronchial tree and the respiratory sacs themselves. This is where the exchange takes place, inside these bags. With typical pneumonia, it is all clean, the process goes on outside. And this is the fundamental difference between pneumonia and viral pneumonitis. And therefore, the treatment here is different. The rehabilitation is also completely different. Now everyone is focused on pneumonia, but this process occurs throughout the body, wherever there are blood vessels. And we often seem to be fixated on the lung. But in general, the body is forgotten. The virus causes inflammation inside the vessels, which in turn leads to clotting of red blood cells inside the vessels. Let's say a person had a CT scan and no pneumonia was found. To check blood, what type of test should be taken? An ordinary analysis, a general blood test. You can show that. Yes, of course. Now, for some reason, there is a division to leukocytes, platelets, with the counting of reticulates. Such a detailed blood test. But the most important thing we need is platelets, right? And of course, leukocytes, lymphocytes, that is the whole formula of blood cells. We need everything here. In addition, a blood coagulation test is important. Blood is taken from a vein. General analysis. Yes. Imagine we have a blood clot forming, and the shaped elements, that is platelets, cause this clot. They are like bricks, and the blood coagulation system is like a solution. That is, in order for us to form a blood clot, we need bricks and a solution between them. So a general blood test shows us these bricks and the coagulation system. Coagulation test shows how much solution is in the blood. It's important that the indicators of both do not rise too high. You need to see a doctor. When I asked, I referred to cardiologists. Right now, they call me from all over Kazakhstan, not even from Kazakhstan, even from the CIS and the US. In general, from all over the world. And they watch us all over the world too. I'm taking this opportunity very well. Do not make independent decisions under any circumstances. Be sure to contact cardiologists. Why cardiologists? Everyone thinks it's a flu. It's pneumonia, so you need to go to the pulmonologist. I would say any doctor you find nearby will help you. But it is cardiologists who will be able to correctly understand the specificity of blood coagulation, all these problems, and prescribe specific drugs that affect these structures. These are not only my observations. There is also a doctor in Russia, Simon Matskitlepshvili, who is the chief Covidologist of Russia. He's a professor of Moscow State University. He's also asked the questions, what does this have to do with cardiologists? What is bad when the blood is thick? First of all, it hits the heart, the coronary vessels, the vessels that supply the heart itself. It also affects the vessels of the lungs, such as the cerebral arteries or veins. If there is some kind of clot, it will be very noticeable. It may lead to a stroke. If the lung is affected, there will be pulmonary embolism. If it's a heart, then it will lead to heart attacks. Can this somehow manifest itself externally? What are its external signs? For instance, swelling of some limbs or something else. First of all, this is the symptomatology of the cardiovascular system. This is the heart. It may be the same shortness of breath. It can be all symptoms. Change of heart rhythm, all symptoms of oxygen deficiency. Many people now rely excessively on a pulse oximeter. I wonder where this fashion came from and why, without pulse oximeters, everyone thinks that they are helpless and don't know what to do. After all, before we could determine the symptoms by the same fingers, the nasolabial triangle, which turned blue, just a feeling of lack of air. This is really a symptom, the fear of death. A person, when he does not have enough oxygen, then his instinct of self-preservation is triggered. If I can breathe, then anything can happen to me now. In addition, they also say that coronavirus infection has a very strong effect on the central nervous system. How does it affect? Our vessels supply and nourish the nerves themselves. And when we have a blood clot, these nerves fail. Most often, this leads to paresthesia and even paralysis. This is a common symptom of the disappearance of smell or paresthesia from the olfactory nerves. Someone feels a bad smell, another feels some particular smell. Or, for example, a girl has been using her perfume all her life, and her brain remembers the smell. And here, all of a sudden, they smell differently. So when the nerve ceases to be satisfactorily, adequately supplied with blood, then transmission along these nerve impulses changes. Our guest today, Yulia, she said that her sense of smell in the country has intensified. She feels everything now. Yes, this is also like paresthesia. At first, I thought it was an atrophy of the olfactory hairs. Then when I noticed that the clinic is different for everyone, for someone this symptom is completely absent, for someone it begins to change. During recovery, when these hairs are completely extinct, that is, they have dried up, it takes a long time for them to recover. And in some patients, I noticed that after 3 days, their sense of smell returns. That is, they could not die out quickly and recover very quickly in 3 days. It's not realistic. Even in a week, they cannot recover. So from the experience of necrotizing rhinitis, I know that it takes a very long time to recover. And then I realized that it was just a violation of innervation, a violation of blood supply. Let's say our leg fell asleep and we stopped feeling it. It takes time to recover. Yes, then we got up, moved, felt first goosebumps. They are unpleasant, and then everything is fine. Ainal Muratovna, proper rehabilitation is no less important part of the treatment than everything else. What to do to make the post-hospital period productive, and for the health to fully restore. First of all, we must monitor the state of the blood. Since in this infection, the target organ is our blood, a large organ consisting of many cells. I recommend that my patients, especially those on anticoagulant therapy, monitor their tests. They need to be tested every 2 weeks. Taking the opportunity that many people are watching now, I would like to appeal to those, especially those who recovered at the beginning of the pandemic, with the help of antibiotics, with the help of common remedies. They even developed antibodies. But you know, since the virus hits this coagulation system, symptoms such as blood clotting may remain. And this may not be clinically apparent. It's necessary to take both general blood test and coagulation test. And be sure to go to the cardiologist for a checkup, because the virus might be gone, but the thick blood remains. And the dangers that can occur due to increased clotting, they stayed with you. So there are still risks. There are risks. You just need to pass a general blood test, coagulation test, and visit a cardiologist. That's all. Secondly, you definitely need to follow and listen to yourself. Is there any anxiety left? Are there any fears left? Because these disorders of both the respiratory system and the circulatory system, they are directly related to our emotional background. I always explain this to my patients who are suffocating. I objectively see that there are no reasons from the breath and the heart to suffocate. I understand that this comes from the emotional side. I say you have to understand that if you have the barrel of a gun pointing to your head, you will forget how to breathe, right? And the heart will pound. Therefore, this is a very important point. That is, you also need to contact psychologists. It is desirable. How to deal with this on your own? It seems to me that you need to move more, to occupy yourself, in order not to think about it. You need to distract yourself. Because now everyone rushes to poke around, dig, look for something. And I say, he who seeks will find. Well, it's true. He who seeks will find, so you need to look at yourself objectively. Better to see a psychologist. or try to work it out on your own if there is no money for a psychologist. I call this morning pages. In the morning, we get up, start the day by writing 3 A4 sheets of paper, writing everything that we have in our head. It's like gadgets. We free our memory from unnecessary garbage. Yes, unnecessary. It's just garbage. We write it down on paper, we do not sort, we do not criticize ourselves, we do not analyze. We just write whatever comes to our mind. We wrote it down, we tore it up, burned it, whatever you want, and threw it away. At this moment, your conscience clears up. It clears up. It doesn't matter how it happens. For example, when you sweep everything into the trash bin, you don't keep track of what happens with all these gigabytes. You just understand that you no longer have this on your gadget. We have freed up memory. Space has been freed up for something good and new. Yes, do not forget that gadgets are a model of the human brain. And it's very simple. This is the first moment in rehabilitation. The second very important point is drinking plenty of fluids. The culture of drinking in our country, thank God, is introduced into our life. There are special applications. I would like to draw your attention to the fact that when you drink more than a quarter of a glass of water in one gulp, even if you do it often, your body is not saturated with liquid. The protective mechanism simply turns on so that your blood pressure doesn't go up. All the water at once goes through the kidneys and is immediately excreted with almost no residue. And you're left as thirsty as you were. So you have to drink. Little, just a little. But the fact that we drink half a liter of water as preventive measures on an empty stomach, how good is it? This practice to drink water in the morning is more for the gastrointestinal tract. It's like a shower for it in the morning. And it's better, of course, to drink warm water. Like any dishes are washed better with hot water than with cold water. Warm water is better, right? Yes, not even warm, hot. When the pandemic had just begun, we heard that with coronavirus, one cannot lie down, one cannot take a permanent horizontal position. You need to move more often. Certainly. Again, remember when I suggested this, a lot of negativity fell on me. How come, in an acute period? What movements are you talking about? What kind of rehabilitation? I just understood from the pathogenesis of the disease that there is no purulent process anywhere. When there is a purulent process, of course, you need to sit quietly and move less, so that it does not spread throughout the body. Yes, move less, so that it does not spread purely, mechanically. This virus has no purulent process. I noticed it when the first people came to the hospital. I had a lot of them. They complained, I'm lying on my back hurts. My back burns. I roll over on my side, it starts to burn here. Some patients complained like this. I have a very figurative thinking. I imagined the hourglass. As I turn it over, I imagined blood accumulating. And that's where it clots. There is an inflammatory process. I realized that the more a person moves, prevents the stagnation, the lower his temperature. During treatment, you need to move constantly. And after, yes. When a person has already recovered, it's necessary to continue an active life. We must take into account the state of the cardiovascular system. There should be no cardio load. For many, you are familiar with your videos on the internet, including how important it is to stay mobile, as you said, and do most importantly, breathing exercises. This is for prevention, treatment, and rehabilitation of patients diagnosed with coronavirus infection and COVID pneumonia. Tell us more about your technique, how is it useful, and what happens to the body during and after such exercises. For the third year, I have been improving my qualifications with doctors from Russia, from Moscow, specifically Temichev, Garkovsky, and his entire friendly team of rehabilitation therapists. Kinesiology here is not very developed. In Russia, it's already developing with might and main. Kinesiotherapy means movement therapy. Since our lungs are affected, and most importantly the infection compresses our vesicles, this respiratory alveoli, yes? And they shrink. They need to straighten out. This requires a kind of chest capacity. More often than not, all our people are like this, like a question mark. Well, I call it a chest horse. Well, so be it. This issue is especially acute in pregnant women. Their diaphragms are tightening, and their lungs have nowhere to expand. Overweight people face the same issue of diaphragm compression. This is a risk group. Sometimes it's very hard to explain. It's hard to explain as a rule, you need to show it, and even more, try it yourself. If you do not mind, of course, I would like to invite our previous guest, Yulia, to try it out. She is currently undergoing a rehabilitation process, and your advice will come in handy for her. Yulia, please come in. We are waiting for you. Yeah, sure. Hello. Good afternoon. Well, let's get straight to the movements. What's important here? Our low back is always at work at 100%. Here it is important for us to immobilize the lower back so that we really move the thoracic region. Our low back is like our mother's, loves to take on everything. So look, let's stand this way. Slightly bend your knees. Yeah, just a little. We draw in the stomach and pinch the buttocks. And now let's imagine that everything below the pelvis is like a butter post. It doesn't move. It is dug deep into the ground, right? And now we try to get our hand there. Yes? And turn the thoracic region all the way back. Do you feel everything that's happening in the thoracic region? We are not moving. That is, look, we usually turn with the pelvis, like a door, right? The most important thing here is to keep your pelvis in place. We can even do this. If we do not hope for your motor control, our task is not to tear off the pelvis. For this, we pull in the stomach and pinch the buttocks. Okay? I see. Excellent. We move our hand here like this. Do you feel all the sensations you have here? Yes, I do. And now let's move the other way. Here's the simplest thing. Is your heart pounding? I think I need a stretching, right? So we're trying to achieve the stretching. How many times we need to do such exercises? Look, remember, I said that there should be no cardio. As soon as you start to feel that you're tired, that your heart is pounding, you stop. Should the speed be exactly as you showed? You know, it should be comfortable. What about breathing? For example, inhale, exhale. Yes, we withdraw. Look, we open up on inhalation. Inhale. And on exhalation, we return. Exhale. And here, look, not only the hand, but the chest opens up, yes? Here. Inhale, exhale. On the other side, inhale, exhale. How are you feeling? And you can change it. And also upright. Here, the entire lung opens up completely with the lower sections too. Try inhaling and exhaling. Inhale and exhale. Again. Yulia, how are you feeling? Okay, I think even better after exercise. Excellent. Do you feel like you have more air in you than usual? Yes. Somewhere here. Also, such a practice, it's suitable not only for coronavirus. It also works for the prevention of heart attack, stroke, and whatnot. As we inhale, we raise one shoulder, and as we exhale, we lower it, raise the other. Inhale and exhale. And look, we don't meet the shoulder with our head. We have the top of the head up, and with our shoulder we reach the ear. Inhale, exhale. Inhale, exhale. If you do this intensively, often, your head begins to spin. But everyone experiences it differently. This is hypercapnia, when there is more carbon dioxide in the blood. And this is the training of our heart, brain, blood vessels. In general, any physical activity, when we do something, run, take a brisk walk, or just do some aerobics, always after that a person feels good. And this exercise helps precisely during rehabilitation after coronavirus infection and after pneumonia. In general, to people with problems of the respiratory system, right? Yes. Well, Айналь Муратовна, Yulia, thank you for coming to our studio. I wish you health and, of course, your loved ones. Thank you. Thank you. Thanks. Thick blood is a term that lately has been on everyone's mind. Anticoagulants, blood thinning drugs are included in the official protocol for the treatment of COVID and pneumonia with signs of COVID. In our studio today is a surgeon, head of the Department of Interventional Cardiology and Endovascular Surgery of the City Clinical Hospital No. 7, Saken Anartaev. We'll talk about what thromboembolism is. And we will also learn what is important and what is not recommended to eat during a pandemic. Saken, hello. Thank you for coming.
Hello. Saken Anartaev, Head of Department of Interventional Cardiology and Endovascular Surgery, graduated from Sanjar Asfandyarov, Kazakh National Medical University, Specialization Therapy.
Pulmonary embolism, abbreviated as PE in conjunction with diagnosis of COVID pneumonia, what exactly does this mean for the patient? How dangerous is it?
Pulmonary embolism is a sudden arrest of the blood flow to a pulmonary artery. The highest risk group are those infected with COVID-19. Pulmonary embolism is a sudden cessation of the blood flow to the pulmonary artery as a result of clogging of the artery by blood clot. Complications such as pulmonary embolism are common in infected patients with COVID-19. This is precisely due to the intoxication of the body and dehydration of the body. And if a patient develops pulmonary embolism, the chance of survival is very low. In the treatment of COVID infections, patients are often prescribed anticoagulants according to the protocol.
To thin the blood.
Precisely.
Second, what happens to the blood when anticoagulants and thrombolytics get into it?
They stop thrombus formation, reduce fibrin activity. In this regard, a blood clot does not form in the human body. We prescribe drugs, specifically anticoagulants, to those who have COVID infection. And if we diagnose thromboembolism of the pulmonary arteries in patients, we prescribe thrombolytic therapy to such patients according to the protocol to dissolve the clot.
Second, how can you tell if a person has a blood clot? Are there any external signs, symptoms? A person might not know. It happens, unfortunately, when someone threw a blood clot. I don't know if I said the right thing. That's what they usually say. And they lose a person. How to identify it in advance? Are there any signs that you need to pay attention to and go to a doctor?
In patients who have COVID infection and pneumonia, visually it is difficult to diagnose pulmonary embolism. If a patient's oxygen saturation is below 90% and he complains about shortness of breath, we take tests. First, it is D-dimer. The dimer shows whether or not there is blood clots in the body. If a patient is suspected of pulmonary embolism, contrast-enhanced computed tomography is prescribed for such patients according to the protocol. It is the study that this is a gold standard. It shows whether or not a patient has pulmonary embolism. There are also other research methods. This is hydropulmonography. It is carried out through the femoral vessel. The femoral vein is punctured, and through the femoral vein, inside the pulmonary arteries, we insert a catheter, and we let the contrast agent through the catheter. Then we shoot on X-ray video. Then we can already determine whether or not there is a blood clot inside
Quite
the
a difficult
artery.
test method, I would say.
Yes, this is an invasive diagnostic method that is carried out in specialized institutions.
Thank you, Seken. As far as I understand, with a tendency to form blood clots, mobility is the first priority, right? Walking, warm-up, exercise, which we have already discussed with Ayna Bakeyeva. But there is something else that should be brought to our attention. We are what we eat, aren't we? What food products contain elements useful for blood and strengthening of blood vessels, and which ones we should avoid? We would like to hear it from you.
We have many products that specifically affect blood clotting. These are raspberries, cherries, oranges, and seafood.
But how useful is corn, coconut, sesame oil?
These types of oil, of course, also have a very good effect on the body.
What vegetables can you recommend?
Tomatoes, cucumbers, garlic, avocados.
What about cabbage, red cabbage, broccoli? Let's once again list the products that are useful so that people in Kazakhstan can pay more attention to them and knew what vegetables should be treated with caution and what vegetables should be excluded from the diet altogether as they increase blood clotting. First of all, you need to control water exchange. Consume at least 1.52 liters of water per day. Food that is considered useful for thromboembolism: raspberries, corn, coconut, sesame, linseed, and olive oil, cashew nuts, as well as fresh vegetables and fruits, avocados, tomatoes, garlic, carrots, broccoli, red cabbage, pumpkin, beets, persimmons, grapes, apricots, citrus fruits, kiwi, pineapple, apples, cranberries, cherries, blueberries, wheat germ, turmeric, ginger, cinnamon, legumes, seaweed, squid, shrimp, shellfish, and mussels. During diet, you should be very careful about eating eggs, fat cheese, whole milk, potatoes, and pasta. The list of prohibited foods also includes foods high in vitamin K, buckwheat, animal fats, lard, butter, fatty dairy products, entrails, especially beef liver, as well as brains and kidneys. In the same list, bananas, walnuts, rose hips, rowan berries, green vegetables, nettles, yarrow herbs, St. John's wort, oat bark, viburnum bark, and corn silk. It's necessary to say no to dishes with a high content of salt and sugar, fatty meat, milk, and dairy products with a high percentage of fat content, rich meat broths, spicy dishes, and any smoked meats and canned food. Second, we appreciate you taking the time and coming to our studio.
Thank you very much.
Nothing beats life, and a healthy life is an ordinary miracle that we all really need today. Please, take care of yourself. This is our common home, Ulken I. I wish to our country and every family peace, health, and tranquility. My name is Aysel Akbarova. See you soon.